Fasting, the practice of voluntarily abstaining from food and/or drink for a specified period, has been a part of human culture and religious traditions for centuries. Beyond its spiritual and cultural significance, fasting has garnered attention in recent years for its potential health benefits. Here are some of the benefits associated with fasting. Number 1. Weight loss and fat loss. Fasting can lead to a reduction in calorie intake, which often results in weight loss. Additionally, during fasting periods, the body may use stored fat for energy, leading to fat loss. Some studies suggest that intermittent fasting methods, such as alternate day fasting or time-restricted eating, can be effective for weight management. Number 2. Improved insulin sensitivity. Fasting can enhance insulin sensitivity, which is crucial for maintaining stable blood sugar levels. Improved insulin sensitivity may lower the risk of type 2 diabetes and help manage existing diabetes more effectively. Research indicates that intermittent fasting regimens can positively impact insulin sensitivity and blood sugar control. Number 3. Enhanced brain function. Fasting has been linked to cognitive benefits, including improved focus, concentration, and mental clarity. Some studies suggest that fasting may stimulate the production of brain-derived neurotrophic factor, BDNF, a protein that supports brain health and helps with learning and memory. Number 4. Cellular repair and longevity. During fasting, the body initiates a process called autophagy, which involves the removal of damaged cells and cellular components. Autophagy is essential for cellular repair and renewal, and it may play a role in promoting longevity and reducing the risk of age-related diseases. Number 5. Heart health. Fasting has been associated with several heart-healthy benefits, including reduced blood pressure, improved cholesterol levels, and decreased inflammation. These effects may lower the risk of cardiovascular diseases such as heart attacks, strokes, and atherosclerosis. Number 6. Metabolic health. Fasting can have a positive impact on various metabolic markers, including blood lipid levels, blood pressure, and markers of inflammation. These improvements in metabolic health may reduce the risk of metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. Number 7. Increased growth hormone production. Short-term fasting can lead to an increase in growth hormone secretion, which plays a role in metabolism, muscle growth, and fat burning. Higher levels of growth hormone may promote muscle retention during weight loss and support overall body composition. Number 8. Potential cancer prevention. Some animal studies suggest that fasting may help prevent cancer by reducing the growth and spread of cancer cells. Fasting may also enhance the effectiveness of certain cancer treatments and improve the body's response to chemotherapy. Number 9. Improved gut health. Fasting may promote gut health by allowing the digestive system to rest and repair. It can also modulate the gut microbiota, promoting a healthy balance of beneficial bacteria. A healthy gut microbiome is associated with better digestion, immune function, and overall well-being. Number 10. Emotional and spiritual benefits. Beyond its physical health benefits, fasting is often associated with emotional and spiritual well-being. Many people report feelings of increased mindfulness, gratitude, and inner peace during fasting periods. Fasting can also serve as a time for self-reflection, spiritual growth, and connection with one's faith or beliefs. It's important to note that while fasting may offer numerous potential benefits, it may not be suitable for everyone. Individuals with certain medical conditions, pregnant or breastfeeding women, and those with a history of eating disorders should consult with a healthcare professional before attempting any fasting regimen. Additionally, proper hydration and nutrient intake before and at the end of fasting are essential to prevent dehydration and nutrient deficiencies. Overall, fasting can be a valuable tool for promoting health and well-being when practiced safely and responsibly.